Hello, I'm Bobbie Bagley, and I'm the Director of the Division of Public Health and Community Services for the City of Nashua. And we're here now at Public Health Matters. I'm joined today by Jane Goodman, who is a new employee that is brought to us from the CDC Foundation as a part of surge capacity and staffing in response to our pandemic event of COVID-19. I'm very happy to have Jane join us. Her role is as the communication specialist with the Division of Public Health and Community Services, and Jane will be my co-host on Public Health Matters. I'm going to have Jane introduce herself and tell you a little bit about who she is and why she decided to come and join us at the Public Health Department. Jane?
Hi, Bobbie. Thank you. Again, I'm Jane Goodman. I live about 10 minutes from the Public Health Department, so I'm thrilled to be able to work in Nashua and to work on behalf of Nashua Public Health and the CDC Foundation in response to the COVID-19 pandemic. My past experience has been around project management in oral health and asthma and chronic obstructive pulmonary disease. So we're going to roll all that experience into one and work a lot on messaging and hoping to get a lot of words out to the Nashua community about how to stay safe during the pandemic and how to take good care of yourselves. And I'm just delighted to be here and to learn a little bit more about what you've done in public health from the beginning of March, because here we are sitting 6 feet apart and socially distanced. And we're really anxious to hear what the City of Nashua has done in response to the pandemic. We're able to be back in studio, and we hope to be here each week. So can you just tell me, Bobbie, what's it been like? I mean, you started in March. You said it's been crazy. It's been 24/7, 7 days a week during this crisis. So tell us a little bit about your experience.
So Jane, you know what? See, I love that because you just hit the ground running with that. See how she just kind of moved into her role as communication specialist? This pandemic event has really allowed for public health to just be in the forefront in response to everything that's been involved with COVID. And so people are hearing every day about cases, about numbers going up, about surge, about flattening the curve. And, for us from the onset, it has always been about what are the things that we could do to help make sure that we can control the spread of this pandemic event. Early on in March, it was really, for us, providing the monitoring and the surveillance as we watched what was happening in China and what was happening in Europe with regards to the number of cases and how the infection was spreading really quickly throughout the world. The pandemic event was declared in March, and we had a number of cases that we started to see in the state of New Hampshire. So we knew that with a disease such as COVID, with the exposure being respiratory spread, that we were going to be looking at something that was really serious in our state, and that was going to impact a great number of people, in the state and our populations.
So when did you really start to see an uptick then of the coronavirus in the Nashua or New Hampshire area?
So it pretty much started out pretty slow for us initially, but it doesn't take much for things to really just kind of spike off. Our first case came to us in Nashua on March 13th, and I happened to get that first case. I remember I was in bed. I got a call probably about 9:30 from our Department of Health and Human Services to say, I'm calling because you guys have your first case of COVID-19. And then from there, that one case turned into several contacts, with investigation, along with the cases, because once we identify a positive case, we want to know all of those who may have been exposed to that individual, what was the context, what was their work setting, and then contact all those folks to make sure that they are either tested and make sure that we can identify what signs or symptoms that they may be having. I think that we sort of picked up really quickly, probably in the month of April, because we were getting our cases, one at a time. Once COVID started impacting our long-term care facilities, that's when things really surged for us.
Okay. So am I understanding correctly then, your first case came before even the state of New Hampshire kind of closed schools and all of those things?
Yes.
And so you were already already at the forefront of the pandemic. How can you explain to us a little bit about what public health, you mentioned the contacts and the contact tracing. So just explain that role a little bit more in detail about what public health is doing on behalf of the Nashua community. I mean, of course, you kept abreast of what was going on in other states, and then you were notified. When that happens, what else has public health been doing?
So part of what we do on an ongoing and regular basis is around monitoring, for diseases. And we tend to pay attention to what's happening just south of us on across the Massachusetts border because we're right across, the Massachusetts line. And so for us, initially, what we began to do is convene our incident response team. So we were having weekly meetings. And at that time, we only had to meet weekly. To get the updates, to get the reports, getting information out from the Department of Health and Human Services here. We opened up our MACE, which is our multi-agency coordinating entity, which would allow for us to communicate with our partners as well. One of the other things that we found to be very helpful for us early on was to make sure that we were meeting with our partners because of how we saw COVID expanding, over across the border and, in Europe and other places. We knew our hospitals were going to get hit pretty hard. And so we started to convene meetings weekly with our hospitals, St. Joe's and Southern, just to learn about what they were experiencing and what they were hearing. So from the start, it was important for us to, as a part of a unified command system, have ongoing communications, provide as much information as we could to all of our partners so that we could be united in our response. When you have something that's going to impact your hospitals, and as you said, the schools came along, a little later, our broader community-based organizations, everyone needs to be prepared. And so we have been working for years, Jane, on our emergency preparedness plans, making sure we had MOUs in place. So these are things that we did on a regular basis. We had been looking for some type of pandemic event because we hadn't had anything in a while. H1N1 back in 2008, 2009 was our last pandemic event that had occurred. And so we knew within like a 10-year cycle period that something was going to come. We expected a flu type of event. COVID as a novel respiratory illness really surprised pretty much everybody. The World Health Organization, the CDC, and how quickly this disease spread and across all population groups, across different age groups, and we just knew that certain populations were going to be at higher risk than others because of this respiratory illness.
So it's been a journey.
It's been a journey, and we're still on the road.
And that was my next question.
Yes.
So thank you for that introduction.
Yes.
Are we out of the woods, would you say, Bobbie? Or do you think that, what do citizens need to do, residents of Nashua and Greater Nashua, really?
Yes.
Because we don't just serve the city of Nashua. We do have a reach into the Greater Nashua community and the other towns. So what should people be doing? And how, do they need to continue to be vigilant?
So, Jane, those are really good questions, and we do. We're not out of the woods because this pandemic event is not over. As many have probably been seeing on the news and hearing in the media, there has been a surge of cases, throughout the United States with the reopening of activities, right? And so, things shut down in March so that we could slow the curve of this pandemic. That's what we wanted to do. We wanted to flatten it. We wanted to stop and wanted to reduce as much exposure as we could. And so by closing down businesses, shutting down restaurants, closing down the schools, closing down all types of activities where large numbers of people were going to be gathered together was going to be really important because a virus or a disease that spread through respiratory droplets needs for people to be close together in large settings where there's lots of people gathered together. And so when you close those things down, that kind of, stopped the spread of this infection, to a point where it slowed it down. And at this point now that we're starting to open up our economy by opening up our businesses, it allows for people to start coming out and gathering in places, where they're closer than what we are, closer than 6 feet apart from each other. And in settings where there's more individuals other than your immediate family members all together in places gathered together. So, our expectation is that we're going to see the number of cases go up because of those activities. What we would like, Jane, is for people to be mindful of that. We need to have businesses open because of the boost to the economy. When things shut down, people lost their jobs. When people lost their jobs, they lose that opportunity for revenue, especially for people who don't have, money saved. As much as you talk about, making sure you can have a little bit of money saved just in case there's an emergency, you're not expecting something like this.
The reality is most people don't.
Exactly. And we've been in this event now, we're in the month of July, so it's going on 7 months, you could say, because the virus got started in December, right? And so for who would expect to have that much saved for 6 to 7 months where you wouldn't have, income if you needed to, not work for that long period of time. Things shut down for us in March. And, with things opening back up, it allows for the economy to get started again, but it also allows for increased exposure opportunities. So we are expecting and would like for people to think about their own personal health and safety, as well as the health and safety of their family members, their community, folks that they work with. And so there are certain mitigative measures that we've put in place, and certain preventative and protective measures that we've been asking the city of Nashua, community members, our partners, visitors, we're asking them, to do. One of the things that we've asked, and we have our lovely mask here, we put in place a mask ordinance that individuals, when they go into our public buildings, they go into our businesses, that they wear their masks. Anytime that people are together in areas where there's common space, common shared areas and spaces, we want people to wear their masks. We want them to wear them correctly as well. We've read some statistical information that says if 60% of the population wears masks, and they're wearing them 60% of the time appropriately. So I'm going to show you the appropriate use of wearing a mask, right? So this mask is covering my nose and it's covering my mouth. Appropriately is not this, where my mucous membranes, are available to the virus, which loves, mucous membranes, eyes, nose, and mouth, but covering both. And then making sure that I'm not handling the mask, right? And so the mask is only going to be as good as protection as I allow for it to be. If I'm handling my mask and there's germs or virus on the outside of it, and I'm handling it, and then I touch my eyes or my face, and then I take it down, and now I'm touching my mouth, I'm exposing myself to everything that was on the outside of this mask. And so appropriate use is wearing it the appropriate way and then making sure that we're not handling it. And then also making sure that people continually wash their hands with soap and water when they can, and if they can't, using an alcohol-based hand sanitizer. 20 seconds, sing the happy birthday song, make up another song, whatever song you want to sing to yourself. But keeping your hands clean, that hand hygiene is really important. One of the things that I always emphasize as like the number one thing is if you're sick and you're not feeling well, that people just stay home. That's the best thing that they can do. We know that there's some population groups that have greater risk factors than others when it comes to COVID. If they have underlying health conditions such as hypertension, diabetes, asthma, any kind of chronic disease, lupus, if the immune system is compromised in any way, that individual, when they're exposed to the virus, may have a worse health outcome than someone who may be healthy, may be exposed to the virus, and may have milder symptoms. They may not end up in the hospital, but someone else may end up in the hospital, may end up on a ventilator, may end up dead, right? And so some of the measures that we're hoping, like, these simple things that are kind of cost effective, relatively cheap, wearing a mask or face covering, washing of our hands, the social distancing that you and I are honoring right now in respect of one another's health and well-being, and then really staying home, if you don't feel well.
Right. And people are getting together again. And as you said, you can't blame them because being inside for a long time. But there's a lot of recommendations. Just keep it outside. It's really the best place as long as the weather is good. If you can be outside, and again, even social distance poolside, you don't need to be on top of each other, no chicken fights in the pool, those kind of things. So just, bear that in mind and use those as guides as you move forward.
Yeah, and I love the thing, there's a term that, Jane, you came on board, you hit the ground running, and you came up with this term, safer at home, right? Once the governor put out the safe at home guidelines, the safer at home for many people is really going to help them with maintain their health and their well-being, because there's still some individuals that really don't need to go out and engage in large group activities if they don't have to, especially if you know that you have a compromised immune system. We do know that our population of individuals over the age of 60 is a pretty vulnerable population. And so if at all possible, as much as people can stay at home that may end up with poor health outcomes or become sicker with this illness, we are asking those folks to try as much as they can to stay at home as much as they can. But if they have to and really believe that they need to go out for their mental health well-being, right, for their entertainment, that they just take those protective measures and place them very seriously.
Great. Well, thank you, Bobbie. This has been really informative, and I hope people will take this to heart and wear their masks and stay 6 feet apart and enjoy the summer.
Thank you, Jane, and I am so glad to have you on board, and I'm looking forward to all of the work that you're going to do with us while you're here.
Thank you.
You're welcome.
Now the weather's getting nice. We want to make sure that we're getting outside, maybe do a little fishing, maybe do something to get your heart rate up, go for a run, maybe go bike ride, go for a little walk. But make sure when you're doing these activities that we're still practicing good social distancing techniques. Make sure to wear your mask and stay 6 feet apart and continue to wash those hands. Everybody stay safe.
So we're back with a very special guest from Nashua Public Health. We have Angela Consentino here today. Angela is our epidemiologist at the Nashua Health Department. Welcome.
Thank you. Thanks for having me.
So we're really glad to have you here because there's a lot of vocabulary that gets thrown around during a pandemic being one of the new vocabulary words for everybody. But people really need to understand what is epidemiology and what do you do day to day?
Sure. Yeah. So epidemiology, the word itself, literally means that which is on or upon the people. That's the Greek meaning of epidemiology. So I just like that translation because it literally means what is sort of, plaguing the population or what diseases are in the population. So a large majority of the time that an epidemiologist, a local or state epidemiologist spends their time doing would be surveillance, so disease surveillance and biostatistics. So here in Nashua, as the local epidemiologist, I keep track of all sorts of health data and indicators. So we have, communicable disease data. So that's everything from tuberculosis to foodborne illness to things like COVID-19. And then we have chronic disease data, so asthma, heart disease, diabetes. And then, we have like specific health behaviors. So we have, breastfeeding, pregnancy data. We keep track of substance use disorder, overdoses, mental health, suicide. We keep track of all different health outcomes and behaviors. And so, we monitor those statistically, and then we have conversations about what to do, how to address certain health issues or problems that we're seeing.
So how do you see the problems, so to speak, day to day? You mentioned surveillance. So are there certain things that you check daily to make sure there are no upticks in cases of things, or if you notice a pattern, how do you do that? And then what's the system you follow once you see something that is suspicious, for example?
Yeah, so with COVID-19, that's the best example, I think, because we're so hyper-vigilant and focused on COVID-19 right now. So I keep track of the daily new cases of COVID-19 in Nashua and the region as well. And then we also track the percent positives, so the percent of tests that are done that come out positive. And we use sort of these tracking trends as a way to see if there's an uptick or a downward trend. So in the event that we do have an uptick, then we meet with our incident response team and we talk about what we can do. We talk about any new prevention things that we need to put into place, and we also meet citywide to talk about these issues.
Great. So prior to COVID, you were also doing a lot of surveillance, like as part of your day-to-day. I noticed around the public health offices, for example, that there was many hepatitis posters. So that was an incident that was going on prior to this. And how did you notice, for example, that there was an uptick in the hepatitis in the Nashua area?
Sure. So the hepatitis A outbreak came to us. So the state notified us that there's a hepatitis A outbreak occurring statewide because they saw an increase in the number of cases per year. So they were the first to notify us and say, this is coming, be aware of it. And so then we started keeping track of the number of hepatitis A. We were always keeping track of the number of hepatitis A cases, but we just had it on our radar. And then also we were tracking the number of vaccines that we were distributing at the health department. And this was important for us because we really wanted to vaccinate the high-risk groups. And the high-risk groups with hepatitis A were people experiencing homelessness and people who were injecting drugs or had substance use disorder. So we wanted to vaccinate those populations as well as we could, and also reach out to food workers and people who were food handlers, because that's a way that hepatitis A can spread in the community. It can be a foodborne illness. So we wanted to target those groups, and in order to make sure that we were targeting those groups, we had to track where and how many vaccines we were distributing. So it was my sort of role to keep track of the vaccine distribution. And so now with hepatitis A, I just update our data dashboard. So we have a data dashboard that has every health indicator that we keep track of. And this is ranging from social determinants of health, health equity, homelessness data, all the way down to, safety and chronic disease, asthma, everything that we keep track of is in this dashboard. So if anyone in the public wants to see, what we're tracking and what we're looking at, they can just go onto our dashboard and they can see that. And we have a hepatitis A page that shows, the cases of hepatitis A in New Hampshire, the cases specific to Nashua in our region, and then also the vaccine distribution.
So I bring up the story of the hepatitis A really to show how prepared the Nashua Health Department is to deal with the COVID outbreak as well. So that you've had experience in dealing with outbreaks and tracking the data, and you're really putting all of these same skills into the work of COVID-19. And like you said, it's really day to day now, and we're still staying very vigilant on the COVID-19. How do you work as a local, placed in a local health department with the state?
Yeah, so we work very closely with the Bureau of Infectious Disease Control at the State Health Department. So they're the ones that keep track of the statewide communicable diseases, so reportable communicable diseases, which is a long list of reportable diseases. And so then we work with them to sort of review any outbreaks that are happening. So right now with COVID-19, we meet on a weekly basis to talk about outbreaks in long-term care facilities across the state, outbreaks that might be occurring in restaurant workers, and sort of identify clusters and put our heads together on how to mitigate those clusters and sort of reduce public exposure.
And I can attest to the fact that every case now is really tracked very closely in Nashua, discussed what the exposures were, and then it will go to our public health nurses and they'll do some contact tracing. So it's a very busy time still, even though we are flattened out a little bit, and we'll look at some of the graphs in a minute. But it is still a very busy time for you as an epidemiologist and also for our public health nurses who are following up on all those cases that are identified in the Nashua area. So I think that we should really turn to some of these graphs that you have prepared for us today, because they really show a very clear picture of what's been going on in the Nashua region. And I think we'll start really if you just look at our percent positive graph, and if you could kind of explain to us what's going on. This graph starts in March on the far left of your screen. And you know, if you just want to give us a little bit of an update of what you're seeing in the greater Nashua area.
Sure. So this graph tracks all of the PCR tests. So these are the nasal swab tests, and these are the tests that actively detect viral load in your body at the time of receiving the nasal swab. So this is all of the PCR tests that were conducted in the state of New Hampshire, and that's the bar. And then the line is the percent of those tests that returned positive. So if we look back at sort of the peak of our outbreak, which was in, you know, the middle of April, our percent positive peaked at like 17% of our tests being done were positive. And now in July, we're down to 1.9% of tests come back are positive. And so this is a really great indication of spread of virus in the community. And it's also a good way to determine the spread of the virus regardless of the amount of testing that's being done. So we hear a lot that, well, you know, there's increased testing, so of course there's going to be increased cases. But if there's increased testing and the percent positive curve is increasing as well, that's not only an indication of new cases because of testing, it's also an indication of new cases because of increased spread in the community.
Yes.
So that's why this is so important to keep track of.
Absolutely. And it is definitely, you know, you hear that, and there's a lot of confusing information out there about, you know, number of tests versus that. So we have some good news in New Hampshire that our percent positive is 1.9%, is what you said. The next graph that you brought, we have a state-by-state comparison, which is really interesting. And it shows, how is New Hampshire doing?
Yeah, so New Hampshire is doing really great right now, as so are all the other New England states. So this is a Johns Hopkins map, and what it does is it shows you the daily trend of new cases per day by color. So the redder the state, the higher the peak in new cases per day. The greener the state, the steeper the slope going down.
Okay.
And sort of like the white cases or the white states are the ones that don't have that much of a slope, either upward or downward. So they're just
Kind of in neutral.
Yeah, remaining relatively stable. And that's where we are in New Hampshire right now. We're remaining relatively stable. So that's great news. And it's also good news for the rest of New England.
Yeah, and this is a map that people can access online through the Johns Hopkins website.
Yep, Johns Hopkins has a coronavirus resource center, which has so much great information about, you know, state and local epi in regards to COVID-19. So you can go to the Johns Hopkins site, and they have this map along with countless others.
Right. So for those of you who have relatives in different states and you want to counsel them, or you're looking at things, this is a great area. Or if you're planning some travel, you might want to take a look at this map and just make sure that you're taking proper precautions when if you are leaving New Hampshire or coming back in, you know, where you're traveling.
Absolutely.
And honestly, what's very interesting about this map is it seems to be changing daily. I looked at it this morning before the slides were updated, and it had changed. Some of the shades of red had changed throughout the day. So it is definitely something, a great resource for people to use going forward. So now we can talk about contact tracing.
Yes.
Let's just back up maybe and explain a little bit about what it means to do a contact trace. And this is really important in our city right now because our nurses are working so hard to do this. And people are a little reluctant sometimes to answer the phone. So if you could explain what this involves and so that people understand, like, it's okay to pick up the phone.
Sure, sure. So what happens if you receive a positive result of COVID-19 and you're a resident of Nashua? You will receive a call from someone from our disease investigation team. And that person will, usually a nurse, will talk you through, what this means for you. So you will need to remain isolated for 10 days after your symptom onset date. And that means that you can't go to the grocery store, you can't go visit friends or family, and that's really to protect other people from contracting the illness from you. So they'll walk you through that, and then they'll also do an investigation to try and determine, where were you exposed to COVID-19 and who may have been exposed to COVID-19 from your illness. So they walk you through a series of questions and can provide counseling. So if you have any questions for them, they're always happy to answer those questions. And they can also provide you a letter for your workplace or anything else that you might need that says that you are in isolation and cannot do regular activities until you're released from isolation. So the second piece of that is the public health nurse or the disease investigator will then do a contact tracing from that single case. So say I'm positive and I live with my husband and my mom, and my husband and my mom would be contacts to me. So they would need to remain quarantined for 14 days after I'm feeling better. And what happens then is we then monitor those contacts, check in with them daily to see how they're feeling and doing, and make sure that they don't develop any symptoms, make sure they don't have any difficulties. And if they do have difficulties, we're right there. We have a relationship formed with these folks, and we can provide any assistance that they may need.
Great, thank you. That's a very good explanation. We do have a lot, what we'll do at the Public Health Department, as you said, is, go back and call anyone who is COVID positive. And we're just encouraging people, it's not an interrogation, just please, the more people that you've had close contact with, the more isolation can occur and minimize community spread. So if we look at this contact tracing graph, we're really seeing something a little bit different. If you can explain again the difference between the bars and the line
Sure.
for our viewers, and that would be very helpful.
Sure. So this graph speaks exactly to what you were just talking about. So the bars here are the number of cases in our region, and the line is the average number of contacts per each case. So you can see at the peak of our outbreak, like around week 14, at the beginning of our outbreak at around week 14, there was about over two contacts per each case. So this meant that every case came into contact with, on average, 2 people who were then exposed to their virus. But then when the stay-at-home order was in place and people were really practicing social distancing and staying at home, that number dipped really low because they were in contact with less people.
Right, and we see that. We see the line just going right, flattening out almost to the axis there.
Yeah. I will say in week 20, 21, and 22, we had a different software.
Oh.
So it's not,
Okay.
It doesn't always go down to the bottom. But it was low. It was decreasing during that time. And then sort of about, 4 weeks ago, we saw our average number of contacts for each case start to increase. And so that told us people are out and about, people are, visiting with friends and doing their returning to work, doing their normal activities. But this is having an impact on the number of people that are exposed to the virus.
Absolutely.
So now we're back up to about 1.7 contacts per each case in the Greater Nashua Public Health region. It's just informative for us. It lets us know what's happening and what we can do. We really need to continue to push the social distancing and masking and hand washing and try to reduce all the exposures that we can.
Right, and we expect, as we discussed prior with Bobbie, that contact is going to go up as people return to work, as people get back to their daily lives, and that's okay. We're tracking that, except that we just, as you said, we need to be vigilant. We need to know who you were with, people should really keep track of that if they do have any close contacts. Even if, there are play dates that are outside, just, jot down the names, just so you know, it's a safety thing. I ate in a restaurant in Boston, and they asked for our phone number for contact tracing. So I thought that was a really interesting step in the right direction, so that people really understand that, yes, as you're out, it's okay, but please, make sure that you know who you were with and wear your mask. So the next few slides are really about, who are these COVID positive patients, and what is the, if you could just go through that for us.
Sure. So what we see is that in Greater Nashua, and this trend is true for the state as well, that the majority of cases are female. So about 57% of COVID-19 cases are female. So this is interesting. So it poses the question, well, why? Why are females getting sick more often than males? That doesn't really make any sense. But when you look at the epidemiology, and when you look and you see that long-term care facilities are highly impacted by COVID-19, and females live longer than males, then you can see why that percentage is higher for the number of cases that are female, because you're more likely to live in a long-term care facility if you're female, and therefore you're more likely to be heavily impacted by COVID-19. Another interesting thing about this is at our testing sites, we have a higher percentage of women that choose to get tested than compared to men. So I think about 55% of our testing site attendees are females. So it might be something about, the nature of females where they seek testing at a higher rate than males. And that might come into play in this graph here.
Interesting.
Yeah.
It is. Yeah. It's hard to figure out exactly why that's happening. And you mentioned at our testing site, so I do want to give a plug that we do offer free testing every Thursday from 3 o'clock to 5 o'clock. And we'll be starting doing that in the Elm Street parking garage next week. So that will allow us to continue our testing and not be so dependent on the rain staying away. We've had some tremendous heat, so we're happy that we'll be able to move it somewhat indoors, but still have the airway of the parking garage. So I just want to make a little plug for our testing clinics, and those are free. We do ask that you call ahead, and that is 589-3456 if you want to have an appointment. That's just really helps us manage the flow of the line. It's a drive-by testing, and we also take walk-ups. So come on down if you are feeling signs and symptoms, or you need a test to return to work, or whatever your reason may be. So this has just been really informative, Angela. How are you feeling about the data overall now that we're kind of we flattened the curve in New Hampshire? Are there any things that keep you up at night?
I'm feeling really good right now. We're at the 1.9% positive. Our number of new cases per day has remained relatively stable. So we've had this sort of break from, before in April and May where we were, scrambling with the new cases. So we've had this nice break. And so, now we're really planning for the fall. So there are a lot of projections out there that suggest there will be an increase in cases in the fall. So similar to flu, flu season is from October to, early spring. So we might see a similar trend with COVID-19. So we're just preparing for that. We're getting ourselves set up for it, buying supplies, and just, figuring out how we're going to go about addressing any future surges that we may have.
Right. So it's kind of a plus minus. I mean, the good news, we're in this and we have experience now with it. And the bad news is it may happen again. But we'll be ready and prepared. And we have things put in place to address this should the need arise.
Exactly.
So thank you, Angela, for coming today. And thank you for tuning in, Nashua. We ask you to please stay safe, wash your hands, wear your masks. I'm going to put mine on for good measure. I want to put it the right way. Wear your masks, stay safe. Join us again. We look forward to talking to you more on Nashua Public Health Matters.